Hello everybody. Today I will present you the reproducibility of equivocal HER2-ish results in invasive breast cancer and the correlation with HER2 RNA expression as determined by mama typer. HER2 can be tested in breast cancer at 3 different levels. The first level is the protein level with the immunochemistry. The second level is the gene level with the in situ hybridization, or ISH, being the reflex test realized after the diagnosis of 2+ cases by immunochemistry. And the third option is the RNA level with mama typer, for example. The inter-observer variability is already studied for HER2 cases in immunochemistry, especially for low scores like that. And what about ISH? Especially for the equivocal gray zone HER2-ish evaluation. No study mentioned that so far. ISH is generally considered as the gold standard, and this is the workflow provided by the ASCO-CAP in 2018 for the dual probe ISH. And when the HER2 is described by an equivocal label in immunochemistry, a dual probe ISH is realized. And depending on the ratio between HER2 and CUP17 and the average of HER2, different groups are established. So group 1 is considered as positive and group 5 as negative. Easy so far. But what about groups between 1 and 5? This is a gray zone, an equivocal zone to interpret an equivocal result. And what does ASCO-CAP say for that? They advise to recount ISH with minimum 20 cells by a second observer, blending to previous results. And once again, depending on the ratio between HER2 and CUP17 and the average of HER2, different groups are established. And if the results from both observers are the same, group 2 and 4 are considered as negative and group 3 as positive. But what about this group? So with other ISH results. Because if the results from the observer 1 and 2 are discordant, who is right? Do we need a third observer? Do we need to do an average? Should we take precaution only for equivocal cases? So many questions and no answer. ASCO-CAP said for these cases, it should be adjudicated per internal procedures to determine final category. But what are these internal procedures? They don't precise that. So, ASCO-CAP doesn't give clear guidelines to handle these discordant cases. But why discuss about this subgroup of equivocal ISH? Because it doesn't happen that often. Because of that. Because these results will have clinical implication for a patient. So patients from group 2, 4, and 5 won't receive the treatment by Herceptin, a monoclonal antibody specific to HER2. And patients for group 1 and 3 will receive or could receive the treatment. It's really important to identify patients who will benefit most from this treatment, because you don't want to give this treatment to someone who will not respond because of the side effects. And you don't want to deny this treatment to someone who might benefit from this treatment. So yes, it's definitely the reason why it's really important to establish clear guidelines. That's why the mama typer assay was realized to analyze the degree of inter-observer variability into the equivocal ISH and to compare ISH findings with the RNA expression. In the first part, 2 independent observers were invited to evaluate 41 invasive breast cancer labeled as equivocal ISH group 3 and 4 by the initial report. Unfortunately, we didn't have group 2, and 9 cases were added labeled as ISH group 1 and 5 as control cases. In the second part, 32 lesions from the 41 tumors were usable for the extraction from the RNA extraction, because we need enough tissue to carry out this analysis. And the quantitative reverse transcription PCR were performed from microdissected tumor cells. first results show inter-observer variability between different groups. This is the graph show the variability between the initial report and the observer 1. The second graph show the variability between the initial report and the observer 2. This graph show the concordance between the initial the ISH findings from the initial report and the error extraction from the mama diaper. And it's really interesting to see the finding because the initial report showed the worst concordance with the mama diaper. And this last graph shows all results from all observers. So the x-axis, this is the observer 1, the u-axis is the observer 2, and the color show results from the initial reports. So now, if I remove cases from cases with 100% of concordance, I can remove 12 cases. And now, if I remove cases when the majority of opinion is possible, I can remove 20 cases like that. But there are 9 left cases. And what should we do with these last cases? Mama diaper can help us for this situation. So for tissue with enough cases with enough tissue, we did RNA extraction. And among the 6 cases concerned, only 1 should be considered as positive. So in conclusion, some solutions were suggested. In first one, use at least 3 different observers, and the majority of opinions could be help us for these discordant cases. And the second one, the assessment of the HER2 RNA level could help us as an alternative method. By the way, that's why a survey is organized by my lab about HER2-ish practice in different labs among Europe and USA. And the first results are expected in June 2025. So if you want to participate, please contact me. I would like to thank my collaborator from the Netherlands and Belgium to help me in this project, especially Jimena and Angélique, who realized this project of Mama Diaper. Thank you for listening to me.